Good morning, viewers of Instagram. Dr. Hayworth of the Hayworth Institute in lovely Beverly Hills. Let's talk buccal fat pad removal, aka Bichet's buccal lipectomy. This procedure has been around for 40 to 50 years. Yes, you may have seen, oh my God, this is the latest and greatest thing, but it is not. It's a good thing and it is a very bad thing. So let me explain. In well-selected patients, when patients are like 20 years old, you can already know that they have a circle face and they're going to have a circle face when they are 40. They are just born that way. Buccal fat pad, which is done through an incision inside the mouth, very appealing for obvious reasons, minimal recovery, a bit of swelling for about a week, but Bob's your uncle. Before you know it, you've got highlighted cheekbones, provocative shadow, and it's a good way in bringing interesting, in a way, glamorous definition to your face. However, in the wrong patient, a buccal fat pad, if done inselectively, which I have seen so many times, you have seen so many times, is that it will prematurely age a patient. So even though you get a quick fix and you get your highlighted cheekbones, etc., what happens is that those patients a few years later look and they look exceedingly older for their stated age. Not a good look. You've seen that in a few celebrities, as you can imagine. So how do we help those patients who succumb to such buccal lipectomy temptations? Well, it's a hard one, folks. What we'll do is to try to replace like for like with fat that has been removed, and you do a fat transfer into the area. It's a big production. Another thing that I've been more excited about is done because it is easier. It's an off-the-shelf solution done in the clinic, and that is with Renuva. This is this cadaveric-derived fat tissue which has been devoided of all living fat cells and give you a fat cell reaction or rejection. And you're left with this growth factor, collagen-rich lattice network scaffolding in which the fat lives, but now there's no more fat there. So there's just a bunch of honeycomb that has been transferred into an injectable that then, when injected into areas where fat should live in the face normally, will stimulate your own fat to grow. And lo and behold, check the patient out on the right side of the screen, and that is after 2 treatments. It's a great procedure. I like it. So there is such a thing as a buccal fat pad rescue for those cadaveric zombies who've succumbed to the temptations of a buccal fat pad removal. Hope that helps. Stay safe. Stay wise.